Hello and welcome back to another podcast of 1 Minute MRCP by Dr. Raza. Today we'll talk about vaginal discharge. The common causes are due to candidiasis, trichomona vaginalis infection, and bacterial vaginosis. Less common causes are gonorrhea, chlamydia, ectropion, foreign body, and cervical cancer. So if a question pops up in the exam, then you have to keep in mind candida, trichomona, and vaginosis in your mind. Candidiasis usually presents with cottage cheese discharge, vulvitis, and itch, whereas Trichomona vaginalis presents with offensive yellow-green frothy discharge, with vulvovaginitis and strawberry cervix. Bacterial vaginosis causes offensive thin white-gray fishy discharge, so fish with vaginosis and yellow-green frothy with vaginalis. Bacterial vaginosis occurs due to overgrowth of predominantly anaerobic organism named Gardnerella vaginalis. It's the commonest cause of abnormal vaginal discharge. Intrauterine coil device, vaginal douching, number of sexual partners, they increases the risk. Bacterial vaginosis is not an STI and it should be kept in mind. It is seen almost exclusively in sexually active women. Vaginal discharge that is usually fishy, offensive, gray thin and homogeneous are the common features of BV. Vaginal pH is raised because of the fall in lactic acid producing aerobic lactobacilli. Clue cells confirm the diagnosis. These are the epithelial cells with a stippled border. Amsel's criteria is usually used for the diagnosis of BV, and if three of the following 4 points are met: thin white homogeneous discharge, clue cells on microscopy, vaginal pH of more than 4.5, and positive whiff test that occurs by addition of potassium hydroxide and results in fishy odor. Oral metronidazole 400 milligrams twice daily for 5 to 7 days is the recommended treatment. According to BNF, topical metronidazole or topical clindamycin are also effective alternatives. If it occurs during pregnancy, it increases the risk of preterm labor, low birth weight, chorioamnionitis, late miscarriage. Oral metronidazole can be given throughout the pregnancy and it is safe for both the mother and fetus. Trichomona vaginalis is an anaerobic flagellated protozoa that thrive in more alkaline conditions and the incubation period is around 5 to 28 days. Sexual transmission is the most common mode of transmission. It is usually asymptomatic in most men and around 50% of women. In women, it presents with yellow-green frothy vaginal discharge, vulvar pruritus, dysuria, dyspareunia, and lower abdominal pain. Punctuate hemorrhages on the cervix, that is strawberry cervix, also occurs. The pH of the discharge is usually more than 4.5. The diagnosis is done with the help of a wet mount in clinic that shows motile flagellated protozoan, most rapid and the practical method for the diagnosis. Other differential diagnosis could be bacterial vaginosis that usually presents with fishy odor without soreness or irritation. A large dose of metronidazole of around 2 grams is the treatment of choice. It is a single dose therapy and ensures drug adherence. Alcohol use is usually avoided during or less than 24 hours with metronidazole use and less than 72 hours with tinidazole use because it increases the risk of having a disulfiram-like reaction that is characterized by nausea, vomiting, headache, increased blood pressure, flushing, and shortness of breath. For infections with Trichomonas vaginalis, the partner is identified and screened. Men rarely exhibit symptoms. It increases the susceptibility to HIV due to epithelial damage, and multi-dose treatment metronidazole 500 milligrams twice daily for 7 days is used for the treatment. During pregnancy, As already discussed, metronidazole is not harmful and it prevents transmission to the newborn. Infected asymptomatic pregnant women may wish to defer treatment to after 37 weeks of gestation, and it is absolutely safe. Or 2 grams of metronidazole is given in a single dose during pregnancy. If a woman is breastfeeding, then it should be stopped ideally during the course of disease and treatment and around 12 to 24 hours after the last day of treatment.